We're making prescriptions free for everyone who's being treated for cancer, fulfilling the pledge made by the Prime Minister in his conference speech last year. This is really important because the last thing cancer sufferers need is to be worried about finances. So this will save around £100 a year on average for 150,000 people. Driving down the levels of cancer has been really important for this government. Ensuring that we reduce the suffering of cancer patients and avoid them getting that disease in the first place is crucial to this government's strategy on health. In July 2007, we introduced smoke-free legislation, probably the biggest contribution to public health made in the last 30 years. We've also raised the age at which youngsters can buy tobacco from 16 to 18, and from last year we started to vaccinate all young girls against cervical cancer. And it's as a result of our strategy on cancer that the number of premature deaths from cancer is reducing by 2% a year, 18% over the last 9 years. We want to do more. We want to ensure that there's a greater emphasis on prevention. We want to ensure that cancer sufferers are treated as quickly as possible, given the best possible treatment, and we want to ensure that they're supported after leaving hospital. We also want to look at whether we can extend free prescriptions to around 5 million people who have long-term conditions. Can't do that yet, but we are looking to do that over the next few years. So all in all, this is a very, I think, remarkable week when we celebrate all kinds of achievements in the health service, but for cancer sufferers in particular, I think they'll remember April the 1st, 2009 as the date when some financial burdens were also lifted from their shoulders. When we came into power, fewer than 2/3 of cancer sufferers were referred to a specialist within 2 weeks of their GP suspecting they had cancer. That's now 99.9%. The reason for that is because we put the extra resources and we've ensured that the system responds quickly on behalf of cancer patients. I'm amazed to hear that the Conservative Party would scrap that standard and we could then go back to their record of failure in the health service.